was really minded of in the time that I spent in London this morning around this discussion, because there was hundreds and thousands of nurses there who are forced to immigrate, and nothing has changed. All of the camogie teams, all of the football teams, they were all full of nurses that this country didn't want, and we're giving them the exact same message now. There's no justifiable reason why anyone could oppose the payment of 3,000 student nurses and midwives who are on the front line during the global pandemic. I think because we put a label of student on nurses, we think that it's a carte blanche to be able to exploit them in the way that we've exploited many other students and many students around the accommodation crisis and everything else that's been done. We should not be here in December trying to shame the government into doing the right thing. Student nurses have stepped up heroically. 3,179 healthcare workers have contracted COVID. That's over 7% of all cases. They deserve to be paid for the work that they're doing. They need to be paid for the work that they're doing. Students on placements often work weekends at various forms of care facilities. That's how they support themselves through college. Due to COVID, they had to give up these part-time jobs due to the dangers of cross-contamination. The government comes across as completely out of touch when it doesn't even dawn on them that many of these students need an income to live on. They are not paid. They are unable to learn. On top of all of this, they are expected to pay €3,000 fees and often multiples more in rent. We are telling them to give up their job, to work for free, and they still have to pay the highest fees in the EU. And we wonder why we have problems retaining nurses if this is how they are treated. Absolutely something has to be done about this. They are not asking for a handout or give out. They're asking to be paid for the very, very hard work they did. And I think my colleague put it right when he said, nobody calls them student. They're called nurses because of the work that they do. And I want to thank them here today for what they do. But we need to step up to the mark.